So, today we are going to talk about the secret strategies doctors use to help you get pregnant in PCOS. And that is with medications. They use tablets like clomiphene citrate, or they use letrozole, or they use gonadotropin injections. Now, you need to understand how natural ovulation happens. Naturally, it's a very delicate mechanism. The hormones are like doing this naturally. So when your periods come, all your hormones have come down, and the brain is like, oh, she's ready to make a baby again. So the hormones will start rising slowly. The FSH will start rising, the estrogen will start rising, and they will start making an egg naturally. And in middle of the month, the egg will become like nice and tight and mature, and that's the time the luteinizing hormone comes in, which like ruptures the egg, and that's the time she will have sex. Normal hormones are secreted, man is attracted, and she is having this chance of getting pregnant. That is not happening for PCOS women. PCOS women, because they are having insulin resistance, their luteinizing hormone is slightly high, their FSH has no clue, brain has no clue. Brain thinks there is so much insulin resistance, there's almost like a diabetes thing happening here. It's not safe for her to have a baby. Also, the brain is increasing the androgens so that you're getting all these hair all over you, which is sort of like making not attractive, like making you like a man. Probably this is what I'm thinking, and that's why we are programmed to not have babies, because the insulin resistance is so high. So doctors and the healthcare figured out a shortcut to cheek around the system. They found out drugs which can like bring these hormones down and sort of simulate the natural process. That's what happens with ovulation induction. But I would recommend never ever go for ovulation induction without correcting your insulin resistance, because that's a shortcut. Trust me, you will get pregnant with medication. That's no doubt. I have never seen a PCOS woman not get pregnant with treatment, unless there are other factors involved in it. But if she's just having PCOS, she'll always get pregnant. But never ever go for ovulation induction without correcting your insulin resistance. By that I mean you need to become insulin sensitive. By that I mean you need to come to your natural body weight, the normal BMI, before you get pregnant. Because understand why your brain is not letting you get pregnant, because you have this type 2 diabetes type of thing happening. You have insulin resistance, there's sugar floating in your blood. The sugar is not good for you or your baby. It's a chronic dose dependent hepatotoxin. The sugar is not supposed to float so much in blood. It is harmful for you and the new baby. So that's why your brain is preventing you from making an egg. And now that the doctors have figured out a way to get you pregnant, we will get you pregnant, but then you will still be at risk of complications associated with insulin resistance, like miscarriages. So many type 2 diabetes patients miscarry. Now you don't have to type 2 diabetes, but you still have insulin resistance, and the risk of miscarriages are high. Secondly, you might get infections. You might get a premature leak at around 15-16 weeks of your pregnancy, which can cause you a miscarriage, which is very, very heartbreaking. You might go in preterm labor because of, again, infection at around 25 weeks, 27 weeks, 30 weeks. That can happen. You might be at risk of diabetes in pregnancy. That is another headache. It's a big complication, because then you have to monitor your sugars constantly. You might need an induction. You might need a delivery. Your baby might be doing some weird things, very difficult delivery. Baby will have hypoglycemia afterwards. So many complications because of insulin resistance. Apart from this, the ovulation induction medications, they have twins, triplets, ectopic pregnancies. All these complications can happen. All of this can be avoided if you become insulin sensitive. I'm not saying you don't take treatment to get pregnant, but just become insulin sensitive first so that you prevent yourself from getting all these complications. Now, for PCOS women, we don't know when we are ovulating. So the normal methods of testing, I'm going to ovulate, so I will have sex now. You can use ovulation strips if you want. You can measure your temperature if you want. You can get your doctor to assess if you're making an egg every month or no. But the best strategy and best tool that you have you can use every time is to have sex every 2 to 3 days. The benefit of that is that you take off the pressure of having sex during ovulation. Plus, it's extremely important for your partner or your husband to keep producing those sperms every 2 to 3 days, so that he's keep constantly producing good quantity of sperms, good quality of sperms. And also, you both are, your brains are like, okay, we need to do this. We want to meet together to keep making babies. So that's like my favorite tool that you can use to get pregnant. All right, that's it for today. I will see you tomorrow.